Did you know that something as simple as how often you shower could be silently affecting your health, energy levels, and even how long you live? For decades, most of us have followed one golden rule: take a shower every single day to stay clean and healthy. We learned it from our parents, taught it to our children, and practiced it faithfully our entire lives. But here's the shocking truth that doctors are now speaking up about: after the age of 60, daily showers could actually be doing more harm than good. That's right, what once felt like a refreshing, healthy habit could be slowly weakening your body's natural defenses, irritating your skin, increasing your risk of falls, and draining your energy without you even realizing it. And the worst part? Most seniors have no idea this is happening until the damage is already done. In today's video, we're pulling back the curtain on this little-known topic. You're going to learn the surprising science behind how your aging body reacts differently to daily showers, the dangers of overbathing that most seniors and even some doctors overlook, the safe, doctor-approved shower routine that keeps you clean, healthy, and independent for years to come. And I promise you this: once you hear what's coming in reason number 6, you may never think about showering the same way again. But before we dive in, let me quickly ask you this. Backhand index pointing right if you're passionate about staying healthy, independent, and informed as you age, you're in the right place. Here on Elderkind, we share practical, doctor-backed tips for living longer, stronger, and happier in your golden years. So do yourself a favor, hit that subscribe button now and tap the bell icon, because you won't want to miss the life-changing advice we have in every video. Your future self will thank you. Now, let's start uncovering the truth. The first reason doctors say seniors should rethink their shower habits has to do with something you may already be struggling with: the health of your skin. One of the biggest mistakes many seniors unknowingly make is sticking to the same showering routine they had 30, 40, or even 50 years ago. Back then, a daily shower might have felt refreshing, your skin could handle it, and you walked out of the bathroom feeling energized and clean. But as we get older, our skin changes dramatically, and what once was harmless can quietly become harmful. One, aging skin is naturally thinner and more fragile. Let's start with the science. As we age, our skin naturally loses collagen and elastin, the proteins that keep it thick, smooth, and resilient. It also produces less natural oil, the protective layer that locks in moisture and keeps harmful bacteria out. Now imagine what happens when you take long, hot showers every single day using the same strong soap you've used for decades. That little bit of natural protection you have left gets stripped away, leaving your skin exposed, dry, and more prone to cracking. Dermatologists explain it like this. Think of your skin as a brick wall. The bricks are your skin cells, and the mortar holding them together is made up of natural oils. When you shower too frequently, especially with hot water, you're washing away that mortar, leaving gaps where water escapes and bacteria can sneak in. Over time, this leads to dry patches, redness, constant itching, and even painful infections. And for older adults, that's more than just a comfort issue, it can turn into a serious health risk. 2. The danger of microcracks and infection. Here's something doctors warn about but rarely gets talked about: microcracks. These are tiny, invisible splits in the skin caused by dryness and overwashing. At first, you may not notice them, maybe just a little itchiness or flaking. But for seniors with a slower immune response, even a small break in the skin is an open door for harmful bacteria. This is why so many older adults struggle with skin infections, sores that won't heal, or recurring rashes. Often, it starts with overbathing, something that seems healthy but is actually making your skin weaker. Take the story of Harold, an 81-year-old I once met at a senior wellness seminar. Harold had been a daily shower guy his entire life. Rain or shine, he stood under hot water every morning, scrubbing with strong soap from head to toe. Over time, his arms developed red, scaly patches that refused to heal. The itching drove him crazy. Finally, his dermatologist explained that his showering routine was the culprit. Harold cut back to 3 showers a week, switched to lukewarm water, and started moisturizing after every bath. Within a month, his skin looked and felt years younger. A small change gave him back his comfort and confidence. 3. The problem with hot water and harsh soaps. It's not just the frequency of your showers that matters, it's how you shower. Many seniors love a long, hot soak or a steaming shower to ease stiff muscles. It feels relaxing, but hot water is actually one of the worst things for aging skin. Here's why: hot water melts away the natural oils your body desperately needs. Without those oils, your skin can't stay hydrated, and every shower ends up causing more dryness. Combine that with harsh antibacterial soaps or body washes with fragrances and chemicals, and you've got a recipe for irritation and damage. Doctors now recommend warm water, not hot. Keep showers comfortable but never steaming. Gentle, fragrance-free cleansers, these clean without stripping oils. Shorter showers, 5 to 10 minutes is usually enough. And here's a tip most people don't think about: moisturize immediately after you step out of the shower while your skin is still slightly damp. This locks in water and keeps your skin barrier strong, reducing cracks, itching, and infection risks. For how often should seniors shower? So, how often is best? Most dermatologists recommend 2 to 3 showers or baths per week for older adults, unless you've been sweating heavily or exposed to dirt. This may feel less clean at first because you've been told for decades that daily showers are a must. But here's the truth. Your skin doesn't produce as much oil or sweat after 60. It stays cleaner naturally. Overshowering does not equal more hygiene. In fact, it removes healthy bacteria that protect you. Strategic washing works better. You can freshen up daily by washing your face, underarms, groin, and feet without doing a full shower. This keeps you clean while protecting your skin barrier. This approach is what many geriatric doctors call smart hygiene, cleaning enough to stay fresh and prevent odor, but not so much that you damage your body's natural defenses. 5. The emotional side of overbathing. This may surprise you, but dermatologists and mental health experts have noticed a pattern. Some seniors overbathe because of anxiety or habit, not necessity. You might feel uneasy skipping a shower because you associate it with not being clean or not taking care of yourself. But remember, clean doesn't mean scrubbed raw. Clean means healthy skin that's protected and doing its job. By adjusting your shower frequency, you're not neglecting hygiene, you're giving your body what it truly needs at this stage of life. 6. Quick checklist: the ideal senior shower routine. Here's a doctor-recommended routine to protect your skin while staying fresh. Shower 2 to 3 times per week with warm, not hot, water. Use a mild, fragrance-free cleanser, avoid harsh soaps. Limit showers to 10 minutes or less. Moisturize immediately after drying off. On non-shower days, wash your face, underarms, groin, and feet. Wear loose, breathable clothing to reduce sweating and odor buildup. Following these small steps can prevent chronic dryness, irritation, and infections, all while keeping you feeling clean and confident. If you're still with us and finding this information helpful, drop a #HealthySkin in the comments below. It lets us know you're here and helps more people discover this important topic. And don't forget, subscribe to Elderkind now and turn on notifications. We post weekly videos packed with practical advice to help seniors live longer, stay independent, and feel their best. In the next part of this video, we're moving beyond the skin and talking about something most people don't realize: how overshowering can actually weaken your immune system, making you more vulnerable to illness and slow healing. This one might really surprise you, so stick around. When most people think about hygiene, they think the cleaner, the better. After all, we've been taught from childhood that washing frequently keeps germs away. But here's what many seniors, and even their caregivers, don't know: your skin is home to a powerful immune system of its own, and overshowering can actually weaken it. Doctors now say this might be one of the hidden reasons why older adults experience more skin infections, delayed wound healing, and even chronic illnesses as they age. Most people think of their skin as just a barrier, a layer of tissue that keeps your insides in and the outside world out. But in reality, your skin is the first line of your immune defense. Covering every square inch of you is a microbiome, a population of trillions of friendly bacteria and microscopic organisms that protect you from harmful invaders. These beneficial microbes crowd out harmful bacteria, preventing infections, communicate with your immune cells to keep inflammation balanced, and help your skin heal quickly after cuts, scrapes, or irritation. Now imagine what happens when you shower excessively, especially with hot water and strong soap. You're not just washing away sweat and dirt, you're scrubbing off your body's natural army of defenders. Without these good bacteria, your skin becomes vulnerable to bad microbes, leading to rashes, slow-healing wounds, and recurring infections. Your skin also has a protective acid layer called the acid mantle, which keeps harmful bacteria and viruses in check. This layer has a slightly acidic pH, usually around 4.5 to 5.5, which is perfect for good bacteria but hostile to pathogens. Hot showers and alkaline soaps can neutralize this acidity, leaving your skin vulnerable for hours. During this time, pathogens can easily take hold. Something that's even more dangerous for seniors with a weakened immune system or underlying conditions like diabetes. Doctors compare it to stripping paint off a fence. Once the protective coating is gone, anything, dirt, rust, or decay, can creep in. Younger people's skin microbiomes tend to recover quickly after overwashing, but as we age, the skin produces less oil, making it harder to maintain a healthy barrier. The immune system becomes less responsive, meaning infections develop faster and are harder to fight off, and many seniors take medications like antibiotics, steroids, or chemotherapy that already compromise their natural defenses. This means frequent showers don't just dry out older skin, they can silence an important part of your immune system, leaving you unprotected right where you need it most. Emerging research shows that disrupting your skin's natural microbiome may even affect your whole body health. Scientists believe a weak skin barrier allows inflammation to enter your bloodstream. Chronic low-level inflammation is linked to arthritis, heart disease, and even cognitive decline, and some studies suggest that overcleaning the skin can lead to an imbalance in good and bad bacteria, which might confuse your immune system and make it attack your own tissues. This is why many experts are now urging seniors to think of showering as medical self-care, not just a routine. The goal is to clean enough to stay fresh, but not so much that you strip away your body's defenses. Meet Linda, a 77-year-old retired teacher. Linda always prided herself on staying clean and neat, taking long, hot showers every morning without fail. One winter, she noticed a small nick on her leg from bumping into a table. It should have healed in days, but weeks passed and the wound stayed open, turning red and sore. Doctors eventually discovered that Linda's skin microbiome was severely disrupted from years of overwashing. Her body didn't have the good bacteria it needed to fight off infection naturally. With medical treatment, moisturizing care, and reducing her showers to 3 times a week, her wound finally healed, and her dermatologist said she had effectively rebuilt her skin's immune shield. Stories like Linda's are more common than you'd think, yet they're rarely talked about. This is why doctors now emphasize skin preservation over overcleaning, especially for seniors. Leading dermatologists and geriatric doctors recommend showering only 2 to 3 times per week unless you've been sweating or exposed to dirt, spot cleaning daily, face, armpits, groin, and feet. With a soft cloth and mild soap, choosing pH-balanced cleansers designed for sensitive or aging skin, avoiding scrubbing with abrasive sponges that damage your skin barrier, moisturizing within 2 to 3 minutes of showering to lock in hydration and rebuild your skin's defenses, and staying hydrated while eating probiotic-rich foods like yogurt or kefir, which support good bacteria from the inside out. It may feel strange at first to shower less often, especially if you've done it daily for decades. But the science is clear. Clean doesn't always mean healthy. In fact, smart hygiene, washing just enough to remove odor and harmful dirt, while preserving your skin's natural defenses, is what actually keeps seniors safe from infections, inflammation, and even some chronic illnesses. Think of your skin as a living ecosystem. Every time you shower, you make a choice. Overclean and strip it bare, leaving it vulnerable, or clean gently and preserve the good bacteria that protect you for life. This small shift in your daily routine could make a huge difference in how well your body defends itself as you age. Our next section dives into a hidden risk you probably never connected to showering: the danger to your heart and brain from hot showers and sudden temperature changes. When you think of showering, you probably picture relaxation, the warmth of the water, the comfort of feeling clean, maybe even a soothing moment to yourself. But for seniors, doctors warn that showering, especially hot showers or sudden temperature changes, can pose serious risks to the heart, brain, and circulation. Some of these dangers are so unexpected that many doctors say they wish their older patients knew about them years earlier, because they could have prevented hospital visits, fainting spells, and even strokes. Let's uncover what medical experts are now advising every senior and caregiver to know about showering safely. 1. The silent danger: blood pressure drops in the shower. One of the most overlooked risks of showering as we age is postural hypotension, a sudden drop in blood pressure when you change positions or when your blood vessels dilate from heat exposure. Here's what happens. Hot water causes your blood vessels to widen, vasodilation. Blood flows to your skin to cool you down. This reduces blood flow to your brain temporarily. If you stand up too fast or the shower is too hot, you can feel lightheaded, dizzy, or even faint. For a younger person, this might just cause brief dizziness. But for seniors, especially those on blood pressure medications, diuretics, or heart medications, this can cause dangerous falls in the bathroom, the number one cause of injury in seniors. Temporary loss of consciousness. Potential strokes or heart strain if blood flow doesn't return quickly enough. Doctors often warn their patients, it's not the soap or water that's dangerous, it's the sudden shift in your body's circulation. 2. Hot showers and the heart, a stressful combination. While warm water feels soothing, very hot showers can actually put your heart under stress. Why? The rapid widening of blood vessels makes your heart work harder to keep blood pressure stable. If you already have arrhythmia, irregular heartbeat, congestive heart failure, or coronary artery disease, this sudden demand can cause palpitations, chest discomfort, or shortness of breath. In some cases, experts say extremely hot showers can trigger a cardiac event in vulnerable seniors. Doctors compare it to running up a flight of stairs without warming up. Your heart is suddenly pushed into overdrive. 3. The brain's vulnerability, mini-strokes and shower syncope. Doctors have also linked very hot showers or sudden changes in water temperature to an increased risk of transient ischemic attacks, mini-strokes, or shower syncope, fainting, in older adults. The brain needs a steady, stable supply of oxygenated blood. Sudden drops or spikes in blood pressure starve the brain of oxygen temporarily, which can cause fainting, confusion, or in rare cases, tiny clots or vessel damage that lead to mini-strokes. Even a brief fainting episode in the shower can be deadly due to falls on hard surfaces or secondary injuries. Neurologists warn that bathroom slips after fainting are among the most common serious injuries in adults over 65, and many of them are preventable. For why age makes showers more dangerous. As we age, our bodies lose some of the flexibility they had when we were younger. Specifically, weaker baroreceptors, these are sensors that help your body regulate blood pressure when you stand up. They become less responsive with age. Slower heart rate adjustment, the heart may not pump faster as quickly as needed to compensate for drops in blood pressure. Nerve sensitivity declines, sometimes, the warning signs of dizziness come too late to prevent a fall. Medications compound the effect, drugs for high blood pressure, heart conditions, or depression can amplify shower-related risks. This is why doctors say that shower safety isn't just about avoiding slippery floors, it's about protecting your heart and brain from sudden circulatory stress. Real-life case, a near-fatal morning routine. James, a 79-year-old grandfather, was known for his morning routine, a steaming hot shower to wake up the bones. One day, while his wife was making coffee, she heard a loud thud. James had collapsed in the shower, fainting from a sudden drop in blood pressure caused by the heat and quick head movement when rinsing. He suffered a mild concussion from the fall and later learned from his cardiologist that his daily showers had been quietly straining his heart for years. Today, James still showers, but now at moderate temperatures, seated on a shower chair, with grab bars nearby. He hasn't had another incident since. 6 doctor-recommended safety guidelines for seniors. Here's what cardiologists and geriatric specialists recommend for safer showers. Lukewarm water only, avoid extremes. The water should feel comfortably warm, not hot enough to make your skin red or sting. Pre-warm the bathroom. To prevent chills, heat the air in the bathroom instead of using very hot water. Sit while showering. A shower chair dramatically reduces the risk of fainting-related falls. Install grab bars, essential for stability if dizziness occurs. Stand up slowly. After sitting or bending to wash your legs, pause before standing straight. Avoid showering immediately after eating or taking medications that lower blood pressure, as these increase the risk of lightheadedness. Keep showers short, 5 to 10 minutes, to limit prolonged heat exposure and blood vessel dilation. Never lock the bathroom door, in case help is needed urgently. Some doctors even suggest switching to evening showers for seniors with morning blood pressure fluctuations, as the body is usually more stable later in the day. 7. The bottom line: clean, calm, and safe. Showering isn't just about hygiene, it's an event that affects your heart, circulation, and even brain function. For seniors, it's crucial to move away from habits that worked in your 30s or 40s but are now dangerous in your 70s or 80s. With small adjustments, you can stay clean without overloading your heart. Avoid fainting or dangerous drops in blood pressure. Protect your brain from sudden stress or injury. Every shower should be safe, gentle, and supportive of your long-term health. That's how you truly live longer and stronger. If this information surprised you, type #SafeShowers in the comments. It helps spread the word to other seniors who may be at risk. And don't forget to subscribe to Elder Kind and hit the bell icon. In our next section, we'll tackle another overlooked issue: how showering affects your sleep, energy levels, and even your mood, and how to time showers for the biggest health benefits. We've talked about how showering impacts your skin, immune system, and even heart health, but when you shower can be just as important as how often you do it. Most people shower out of habit, maybe every morning to feel fresh, or at night to relax before bed, but research now shows that for seniors, shower timing can influence sleep quality, blood pressure regulation, fall risk, overall energy levels, and even how long you live. Doctors and sleep specialists have started to rethink traditional shower routines for older adults because your body reacts differently to hot or cold water as you age. Today, we'll uncover what science says about morning versus evening showers, and how to pick the safest, healthiest time to shower in your golden years. Our bodies follow a natural circadian rhythm, a 24-hour internal clock that regulates body temperature, blood pressure, hormone release, and sleep-wake cycles. For younger adults, the body adjusts easily to different shower times, but in seniors, temperature regulation becomes less efficient, blood pressure control weakens, and sleep cycles shift. Many older adults already struggle with insomnia or early waking, and shower timing can make this worse or better. Doctors recommend using showers strategically to support your body's natural rhythm instead of fighting against it. Many people love a morning shower to start the day fresh, and it has its benefits. A lukewarm shower in the morning can boost alertness, stimulate circulation, and help remove night sweat and bacteria. But there are risks, including morning blood pressure dips that can trigger dizziness or fainting, medication timing that can intensify lightheadedness, and sudden temperature stress from moving from a warm bed into a hot shower. If you prefer morning showers, doctors suggest waiting 30 to 60 minutes after waking up, eating or drinking something light, and keeping water lukewarm, not hot. Evening showers are gaining favor among geriatric specialists because they can improve sleep quality. Warm water raises your body temperature, and as you cool down afterward, it signals your brain it's time to sleep. Studies show seniors who shower 60 to 90 minutes before bed fall asleep faster and sleep more deeply. Evening showers can also reduce nighttime restlessness by washing away allergens and skin irritants, lower stress hormones, and reduce fall risk since fewer bathroom accidents happen during sleepy, rushed mornings. However, evening showers can sometimes cause dizziness, especially after a heavy dinner or alcohol, and stepping into a cool room afterward can cause chills. Experts recommend showering 1 to 2 hours before bed in a warm, non-drafty bathroom, with water comfortably warm, not steaming hot. For seniors who want both the freshness of a morning shower and the sleep benefits of a night shower, some doctors suggest a split routine. Take a full shower at night for cleansing and allergen removal, and a quick morning rinse or face and hand wash for a refreshing start without cardiovascular stress. Regardless of timing, extreme water temperatures are risky. Very hot water can cause dizziness, fainting, or heart issues, while very cold water may spike blood pressure and increase cardiac event risk. Experts recommend warm water, around 37 to 40 degrees Celsius, 98 to 104 degrees Fahrenheit, and avoiding contrast showers unless approved by a doctor. Consider the case of Margaret, an 82-year-old who had been showering every morning since her 20s. She recently felt dizzy after showers, sometimes needing to sit down afterward. Her doctor suggested switching to evening showers, 1 hour before bed. Within 2 weeks, Margaret experienced no more morning dizziness, better sleep quality, falling asleep 20 minutes faster, and improved energy during the day. Sometimes, a simple change in timing can make showering a safe, rejuvenating experience again. If you're a senior or caregiver, consider these doctor-approved guidelines for choosing your shower time. If you have low morning blood pressure, dizziness, or a history of falls, evening showers may be safer. If you struggle with sleep issues or insomnia, evening showers can help. Avoid showering immediately after taking morning medications that cause dizziness. If you experience frequent nighttime bathroom trips, morning showers might be better to avoid extra nighttime activity. And always shower before medical appointments or social outings, choosing a time when you're most alert and steady on your feet. Showering isn't just about getting clean, it's a powerful tool to support or disrupt your body's natural health rhythms. Choosing the right time of day can reduce fainting risks, improve sleep, support heart health, lower stress and anxiety, and keep you safer and more independent. For most seniors, evening showers, done safely, with warm water and a steady environment, are the doctor-preferred choice for long-term health.